Hey guys, it's Dr. Brandie. It's our first episode filmed from my house. The reason I wanted to do this podcast is I think there is so much that's not discussed in the realm of women that are trying to conceive or women that are pregnant that we're not warning them and we're not letting them know so they understand that they're not alone. I'm a pregnancy chiropractor. I've been practicing since 2002. My focus, since I had almost lost my own child and couldn't work from 17 weeks, I started Bloom in 2006, which is a sector of my busy practice in Pennsylvania. I'm still a practicing chiropractor. But for me, pregnancy has become my life. And I am probably the least likely person that would talk about this topic because I have such a diverse background, but not only that, it's I'm not crunchy granola. I'm not somebody that's extremely natural. I'm extremely mainstream. I've been brought up in mainstream. I found uh, chiropractic through an injury with my oldest daughter, and it was something that was foreign to me, honestly. It was a foreign concept in that it was supernatural. And all the people I went to school with were raised in that where they weren't vaccinated, maybe, or they went to the chiropractor when they were younger. I didn't even know what a chiropractor was. I actually worked for a chiropractor when I was 20, and when I applied for the job, I thought that they were like a podiatrist for the spine. I thought they were like a medical doctor. So I had really no idea what a chiropractor was. But in terms of pregnancy chiropractic, it has become my life. And as I said, I am not into birth and all of that. My focus is getting women ready for the most athletic event of their life, potentially. And that lends itself because when I started my career as a chiropractor, I was taking care of professional athletes, D1 athletes, men that were entering the combines. So, like high level people that would push their bodies to the brink. With pregnancy, women are pushing their bodies to the brink, and a lot goes wrong. For a lot of people, pregnancy is thought of being this soft time where, they wear these beautiful dresses and like everybody treats them with respect and, they might get a little backache. That's not the reality for most of my patients. Some of my patients come into my office in their pajamas, covered in snot because they haven't been able to sleep. Some of my patients come in and they can't sit at their job. Some of my patients come in and they're taking care of other kids and they feel like a failure because they know they're not able to do the things that they need to do. They are unable to be the person that they were before. And that affects so much with their life. You can think of a time where you've had a hard time and say you're in school and you're doing finals, or you were in the state finals in high school, or your parents are going through a divorce, or you're in a difficult time. I think to understand pregnancy feels like forever, and it's a temporary normal because it's months of your life. It's almost a year of your life. What they don't tell you is typically a woman is pregnant for 41.5 weeks instead of 40 weeks that everybody tells her. It actually goes a little bit longer, which is almost like telling somebody that Christmas is December 15th and it's actually December 25th. So when it comes and goes, you're sort of like, what the heck? So with pregnancy, what I find is there's so much misinformation, there's so much secrecy in discussing the hard things about how things are going to change. And to some extent, and I've said this over the years, in a positive way, as a chiropractor and as somebody that's had two kids, I know what my patients are getting for Christmas. And I know how amazing and life-changing that is. But at the same time, that doesn't negate how hard it was to get there. And my job in practicing and hopefully with the products that I'm making to help women is to help them go through their pregnancy empowered. teach them all the things I did with sports medicine and apply that to the pregnancy. If we do it for athletes, get an athlete back on the field, why can't we do that for pregnant women? If you think about it, it's really, I must use a different word, it's really messed up how if you take athletes, when I used to work with athletes, their team, their care team, was very aggressive with them. So if somebody was in a game, they got injured, there's typically somebody at the site of the game who's on the sidelines, or team chiropractor, athletic trainer, and they're immediately given attention and they get back on the field. If you could extrapolate that to pregnancy, obviously we're not going to have somebody on the side of your field, but let's flip it and think if an athlete was treated like a pregnant woman, they would get injured and they would be told, what do you expect? You just tackled somebody or you just took like a blow to the head. I'm not even going to work on you. Let's wait till this game is over, or let's wait till this season's over. And yet every day women are gaslit by their providers unknowingly. I used to get so upset about that because I was like, why are you telling them there's nothing that they can do? When you tell people that, it disables them. It's also a bold-faced lie. Let me explain. If there's something that is normal, when somebody says, hey, this is normal, you have a problem, oh, that's normal. That implies that they should expect it and that everybody has that experience. And there's nothing that can be done because how that's couched in practice is, oh, what do you expect? You're pregnant, or you should be grateful that you're pregnant. If we took that to athletes and said, hey, you should be grateful that you get to play or that you got to play, we'll wait till your season's over and then we'll fix you. That's what women are told every day. Wait till your pregnancy is over, typically 6 weeks postpartum. Like I was in a car accident. I was hit head on when I was 36 weeks pregnant with my first child because a guy fell asleep at the wheel, ran my mom and I off the road, and went to the emergency room. They told me to follow up with my family doctor. I saw a nurse practitioner, and I'll never forget that because there's so many experiences in my life that seal why I am this person that is driven to give women a better experience. Because if I could indulge you, or you could indulge me for a second, I'm sitting there in pain because my back is killing me because I am huge. I had gained 80 pounds with my first child, even though I puked every day, all day. I found a way to gain 80 pounds because all I wanted was saltines and simple carbs. And I was told that there was nothing that could be done. And I should just go home and do nothing. So when I got in the car accident, as I said, I went to the ER. The next day, I followed up with my family doctor and saw the nurse practitioner, and he evaluates me. Didn't touch my back, had me touch my toes, which is the full examination that was done. And I'll never forget, he didn't know what to do with me because a lot of family doctors, a lot of OBs, this is not a slam on them, they're not taught musculoskeletal stuff. It's not the primary focus of what they do. So he stepped out of the room, literally outside the door, and he's talking to the doctor who he works for. And he came back in, and I said, should I go to a chiropractor? Or at the time, I thought chiropractors were sort of quacky, honestly, but like I thought, like, hey, they do stuff with backs. As I said, I thought that they were like podiatrists of the spine. He's like, absolutely not. Chiropractors are dangerous. And so he proceeded to get up on the examination table with me being 80 pounds overweight. And he's having me do a cat and camel stretch. Like literally, that was the extent of my treatment. Basically, I was supposed to go home, sit in a chair, sleep in a chair, and that was the extent of what he was offering me. He basically shot down, could I seek care? Was there options for care? He said no. That was a lie. The lie detector said that was a lie. That was a lie. And I'll never forget. crying to my ex-husband and saying, like, what do I do? I'm in so much pain and I can't take heavy pain meds. I can't drink. So basically, I just was in horrible pain. What should have been the last 4 weeks of my pregnancy, it ended up being the last 6 weeks of my pregnancy because, as I said, women go later, and I was in a lot of pain and I wasn't moving. It wasn't a great experience, and unfortunately, that's what life is for most women. And as I said, it's not an affront or a slam on their providers. They don't know. And frankly, I don't understand why. I don't know if it's a misogynistic thing or just why haven't we focused on this? There's a thing with pregnancy that like we only get it a couple times if you're lucky, you're and if that's what you want. There's only a few times you get this experience. And for me, I'm not a big feminine person, but that was one thing that I knew was special about being a woman that only I got. And frankly, it was not a great experience for me because of that car accident. With my second pregnancy, I was working. I was 34. I was 9 years older than I had been with my other child. It's a geriatric pregnancy, they call it at the time. Now it's advanced maternal age. And I was working because I needed to work. I worked as a chiropractor, again, with athletes, big, giant D1 basketball playing, football playing athletes. And I loved it. It was sexy. It was sleek. It felt great to be able to get somebody and put them back on a field. And I wasn't really that pregnant. I mean, I was 17 weeks pregnant. And part of my treatment, I treat whole body as a chiropractor, and I was adjusting somebody's foot. And that involves putting their foot between my knees and pulling backwards. So if you can imagine, I'm bent over with their foot between my knees to leverage and to be able to do some force to get that joint, the ankle joint, to move. When I did that, that created a tremendous amount of force in my pelvis, pelvic floor, my pubic symphysis, and my guts, my uterus, my everything, all the soft tissue down there. And I started profusely bleeding with patients in the room. And I had gone to the front area of my office. I walked up real calm. I excused myself. I went to the front of the office and I said to my manager at the time, I think I'm in trouble. And is this a lot of blood? And there was blood everywhere. So I cleaned myself up, not to be personal, and I was like sort of in shock. And she's like, you have to go to the emergency room. And I was like, I got 5 patients in the back. When I finish them, I'll go to the emergency room. I was scared, but I wasn't, I was so focused on the patients instead of myself and my baby. And she ended up calling my ex-husband in because he's also a chiropractor. He doesn't work with me anymore, but called him in. And I'll never forget, she and I are leaving. She's taking me to the ER because she called my ex-husband in and he's holding my daughter's hand, my older daughter's hand. And he's coming in to cover me to see these patients that I wanted to see. And I felt weak. I was scared about my baby, but I was like, oh my God, I let my patients down. And, I needed to finish this off. I mean, they're paying me a service. They showed up for my service. I mean, that sounds so ass backwards, but it was then that I realized, like, I really need to take care of this baby. Like, I think as women, we are taught to almost get pregnant and it's separate from us. It's not a real thing, if that makes any sense. We're supposed to be super women. We're supposed to not let that affect who we are, what we do, because when you start to lose the ability to do things, you lose yourself, right? And so when I went to the ER, they told me flat out I could not practice anymore. And I was seeing three-fourths of the patients of our practice. So if I stopped practicing, then I couldn't feed my kid. I couldn't feed my kid. I could not pay my mortgage. So it was then, that moment between the two moments, that sealed my fate and my passion and my legacy of why I do this. Because I realized I had planned that baby for years, trying to get my practice under control because I was working 80 hours a week with a 4-year-old. Didn't think it was fair to bring a baby into the world. I knew that. But as I just said, like your life as a person, a woman who lives in the United States, there's no stopping. There's no break. If you're lucky, you get 6 weeks. I got 2 weeks before I had to come back to practice and actually practice because financially I couldn't take off. And that sucks. And I regret that and I'm sad about that, that I didn't get an experience. But if you're lucky, you get 6 weeks. During your pregnancy, you're supposed to work just like you did before. You're supposed to be the same wife as you were before. You're supposed to be exactly the same person with your friends, with everybody around you. And the secret is you are going to change in ways that you never expected. You will not be the same person. I'm about to release my book about a partner book, what your partner didn't expect and how you can help, because nobody pays attention to your partner. You both are changing. Your relationship is changing. How you deal with your mom and your dad and your in-laws, if you have them, and your friends, everything changes in such a beautiful way. But when you're going through it, it's hard to let go. It's hard to let go of doing things the way that you did before. You are unable to do the things that you were able to do before. And that sometimes is a big mind screw that you're not ready for that. You're not ready for the fact that you can't lift that dresser. You can't help out in the ways that you did before. You can't pull your weight at work. And so people start treating you differently. So my mission is to empower you as best as I can. If you're having musculoskeletal issues that are debilitating, and let me tell you, this is not rare. I see this every day because our society is extremely sedentary. We are told to do nothing, and then you end up deconditioned, exactly like an athlete would be. Just like if one of the Eagles, I'm in Philadelphia, was injured, the equivalent of that would be their team doctor telling them, hey, you're an athlete. What do you expect? There's nothing you can do. Go home, wait till your season's over, and then we'll fix you. Why are we doing that to women? That's what I want to know. Why wouldn't we take what we know for athletes and apply it to the people that need it, to the people that gave birth to us, to the people that are our sisters, to the people that are our wives, the people that we purport to love, to our people in our employ that we care about? Why don't they deserve that? So that's why I'm put on earth. This is my mission, to help people understand that this is important. Thank you for listening today, and please take care of yourself. Please uh, be gentle with yourself. If you're pregnant right now, please tune in so we can help each other, and I can help you navigate this new normal for you and your partner and your provider. I'm here, I'm down for it all to give you the best pregnancy you dreamed of.